Welcome to Optimal Anesthesia, Mastering Hemodynamic Monitoring. In today's episode, we're diving into the world of advanced hemodynamic monitoring in anesthesia. We'll explore how anesthesiologists calculate pulse pressure variation, PPV, stroke volume variation, SVV, and interpret oximetric waveform analysis. These techniques are vital for ensuring patient safety and optimizing surgical outcomes. To kick things off, let's talk about pulse contour analysis. Don't worry, we're going to make this complex-sounding concept not only understandable but also intriguing. Alright, picture this. You're in a hospital's critical care unit or an operating room, and there's a patient with wires and monitors all around. Among those monitors, you'll often find one displaying something called arterial pressure waveforms. But what do these squiggly lines really mean? That's where pulse contour analysis comes into play. It's like a detective that deciphers those mysterious squiggles. Pulse contour analysis continuously tracks those arterial pressure waveforms in real time. To get those waveforms, a tiny catheter, known as an arterial line, is gently placed into a patient's artery, often in the wrist or groin. This line is connected to a high-tech transducer that turns the pressure changes in the artery into electrical signals. Imagine it as your magic wand that translates blood pressure into data. Now, here's where it gets really exciting. Pulse contour analysis uses complex algorithms to extract key information from those waveforms. It reveals things like the volume of blood ejected by the heart with each beat, that's called stroke volume, the total amount of blood pumped by the heart per minute, cardiac output, and how resistant the body's blood vessels are to blood flow, systemic vascular resistance. So, why does this matter? Pulse contour analysis gives healthcare providers superpowers when it comes to patient care. It's like having a crystal ball for the cardiovascular system. We find pulse contour analysis at work in various clinical scenarios. Hemodynamic monitoring, anesthesiologists and critical care teams use it to keep a close eye on a patient's cardiovascular health. It's like having a dashboard for the heart's performance during surgery or in the ICU. Fluid management, pulse contour analysis helps determine whether a patient needs more fluids or if they've had enough. It's like a GPS for hydration. Cardiac function assessment, by watching how the heart's metrics change, doctors can spot potential heart problems early, even in the most critical patients. It's like a doctor's stethoscope but on steroids. In conclusion, pulse contour analysis is a superhero in the medical world. It takes mysterious squiggles on a screen and transforms them into actionable insights that save lives and improve patient outcomes. It's a bit like magic, but it's science at its best. We're unraveling the mystery behind two critical concepts in medicine: pulse pressure variation, PPV, and stroke volume variation, SVV. Don't let the jargon intimidate you. We're going to break it down into plain language and show you how these concepts are like the heartbeat of modern medicine. Imagine you're in an operating room, and the patient is hooked up to a monitor displaying arterial pressure waveforms. These waveforms are like the heart's musical notes, and we're going to dance to this rhythm. So, what's PPV? It's like your body's response to a dance partner. When you breathe, your heart rhythmically changes the pressure in your arteries. PPV is all about measuring how much this pressure varies as you breathe. To calculate PPV, we'll do a little math waltz. We look at the highest and lowest points of the pulse pressure during a full breath cycle. Then, we plug those numbers into a simple formula to get the PPV percentage. Now comes the interpretation tango. If your PPV is high, it's like your body saying, "I'm ready to dance. Give me more fluids." This suggests that the patient might benefit from a bit more hydration. On the other hand, a low PPV means your body is saying, "I'm good, no more fluids needed." It's like a dance partner saying, "I've had enough." Moving on to SVV, which is like synchronized swimming for your cardiovascular system. SVV and PPV are similar, but SVV focuses on the dance of stroke volume, the amount of blood your heart pumps with each beat. To calculate SVV, we record the highest and lowest stroke volume values during a breath cycle. Then, we do a little math rumba with these numbers. And finally, the interpretation cha-cha. High SVV means your body's dance needs a partner. It's telling us, "I might need more fluids." Low SVV, on the other hand, is like dancing solo. Your body's saying, "I'm good, no need for extra fluids." So, in summary, PPV and SVV are like dance moves of your cardiovascular system. They help healthcare providers understand whether your body needs more hydration or if it's dancing just fine solo. These concepts are instrumental in guiding medical decisions and ensuring patients receive the right care at the right time. We're venturing into the fascinating world of oximetric waveform analysis. Don't worry, we won't be diving into complex charts and graphs. Instead, we're going to take a stroll through these waveforms, making them as clear as a sunny day. Imagine you're in a hospital room, and there's a patient with a small device clipped onto their fingertip. That device is measuring something called oxygen saturation, or SpO2. But what do those wavy lines on the screen really mean? Let's start by looking at the SpO2 waveform shape. Picture it like an EKG for oxygen. You'll want to see a waveform that's as sharp and consistent as a heartbeat on an EKG. Think of it as the rhythmic dance of oxygen. When that SpO2 waveform is consistent, like a smoothly flowing river, it's telling you that oxygen levels are stable and reliable. Just like how you trust a steady river to quench your thirst, you can trust this waveform to reflect accurate oxygenation. Now, let's talk about waveform trends. We're not looking for dance moves here, we're watching for patterns. Imagine this waveform as a musical melody. Any deviation from the baseline melody can signal something important. For instance, if that familiar melody suddenly sounds a bit off-key or irregular, it's like a red flag waving. It might indicate that something's changed in the patient's oxygenation. It's like your body's way of saying, "Hey, something's not quite right here." So, in essence, oximetric waveform analysis is like having a mini orchestra of medical insight. It allows healthcare providers to listen to the rhythm of oxygen in the body and catch any variations or deviations in the melody. In closing, the integration of PPV, SVV calculations, and oximetric waveform analysis in anesthesia practice is a transformative revolution. Anesthesiologists wield personalized patient care, early detection of hemodynamic changes, and precision in fluid and oxygenation management. This integration enhances patient safety, ensures optimal surgical outcomes, and defines the future of anesthesia care. Thanks for tuning into Optimal Anesthesia. Until next time, prioritize excellence in patient care.